So one of the things that we always ask in the clinic is, how are you sleeping? And most patients will say, I sleep okay. And then we ask them the question of, how many pillows do you use? And that's kind of our indicator to know whether they can lie flat or not. We all have a little more difficulty lying flat because it's harder to expand our rib cage and our lungs and get a full breath at night. Plus, when we're sleeping, all of those muscles relax when we're sleeping. So if they're telling me they're using 2, 3, 4 pillows to prop themselves up, it's because they're not able to expand their lungs. So that's one of the first things that we ask them to do is, if you're having difficulty lying flat, prop yourself up. Keeping ourselves upright helps expand our rib cage, helps give us a bigger, fuller breath. We also encourage patients that are having trouble with secretions to use that cough assist and the suction machine before they go to bed. So they're getting all of those excess secretions out before they are lying down. And then if there are any drying medications that we're using, lots of times that medication is also given at night as well, so that they're using the best things that they can to dry themselves up as much as they can to give them a restful sleep for the night. Patients do get very panicky about breathing difficulties, especially at night when they're lying down. So we try to talk about alternatives to that, propping them up so that they are breathing better. Sometimes simple anxiety medications. They're having anxiety about something that actually isn't happening yet, but they've got it in their head that they do. And some patients are very not receptive to getting those medications, but when we add them on, they make life a whole lot better for the patient, especially in getting a restful sleep. So don't hesitate in asking your doctor about those sorts of things, because sometimes one of the first things that you will feel if you do have respiratory compromise is a little bit of anxiety. We want to get that under control so that you do have a restful sleep. You need your sleep for your energy, and keeping that energy level up, and sleep is a huge part of that. Research has shown over and over and over again that BiPAP therapy, when used, will extend the life of an ALS patient by 15 to 18 months. So that's huge. I have some patients that just really don't want to use it, and that's okay if that's what they choose. But when I tell them what the research shows, sometimes that changes their mind. So 15 to 18 months of extra life really is significant when we're talking about a disease that has no cure. So a BiPAP is a great device that can be used and is very easily tolerated. And I honestly think that every patient should at least try it. Those patients that use it have more energy, they feel more rested, and I think that that has directly resulted in their higher quality of life. So for sure, BiPAP therapy is definitely something every ALS patient should consider using.